Madam President, we are going to complete 3 weeks of Senate activity called together by Senator McConnell at a time when the House of Representatives, under the guidance of Dr. Monahan, who was just praised, and I join in that praise, the House of Representatives was not in session. The Senate came to session. I said at the time that it's our responsibility to be here. It's why we ran for office. Important things need to be decided, and we need to be part of it for the good of the nation. But we're about to complete 3 straight weeks without one measure on the floor of the United States Senate relating to the national public health emergency that we face. Not one. 3 weeks, not one. Hearings in some committees, yes. Activity on the floor of the Senate, no. No bill brought to the floor. In fact, an attempt yesterday at a resolution which said the United States should be involved in the global international effort to find a vaccine was objected to on the Republican side. The reason that the senator objected to it, as chairman of the Senate Foreign Relations Committee, is that he wants to take up the measure in his committee at some later date. I encouraged that senator to do it quickly. I think there's a sense of urgency across America in terms of this national health emergency that we face, but there's not a sense of urgency on the Republican side of the aisle. Despite the fact that for 3 weeks we have not considered one measure on the floor related to this COVID-19 circumstance is unexplainable and indefensible. Senator McConnell of Kentucky has told us that he doesn't sense the urgency for us to take up the measure passed last week by the House of Representatives. This was a measure, a bipartisan measure, that was brought to the floor of the United States House of Representatives, which attempted to move us forward from the original CARES Act, the $3 trillion of cumulative spending that we have focused on the economy and the public health challenge facing our nation. Is there any urgency to it? Well, I sense that urgency every time I pick up the phone or read the newspaper in my state of Illinois. I'm on conference call after conference call by groups across our state who are concerned about economic issues as well as public health issues. There is truly a sense of urgency where I live. I cannot believe that Senator McConnell doesn't sense it in his own state of Kentucky. Kentucky hospitals and healthcare providers have received $900 million in CARES Act funding. I don't question whether they were deserving or needed it. We received funds as well in the state of Illinois. But the Kentucky Hospital Association tells us that the hospitals in Kentucky are expected to lose $1.3 billion in March and April alone. You know, we are next door to Kentucky, and my hospitals in downstate southern Illinois, right next to Kentucky, have told me the same thing. They're losing money right and left. Do they think this is an urgent problem in Illinois? You bet they do. And I'll bet the hospitals in Kentucky do as well. Listen to what the Vice President of the Kentucky Hospital Association, Carl Hurd, said, quote, "Since there's no clear path to recoup these losses, the hospitals are left with no choice but to look at their own operations to cut as much cost as they possibly can," close quote. The University of Kentucky is projecting a $160 million loss for its healthcare system. It has furloughed 1,500 employees. Jenny Stewart Health in Hopkinsville, Kentucky, has furloughed 248 staff members. Appalachian Regional Health, headquartered in Lexington, will furlough 500 employees. St. Clair Health in Moorhead furloughing 300. Pikeville Medical Center furloughed 200. Is there a sense of urgency in these communities when many of these hospitals are the largest employers in town and hundreds of people are being furloughed because of the COVID virus, because of the fact that they cannot resume ordinary hospital operations with this shadow of infection hanging over them? The bill that passed the House of Representatives last week, which we did not consider or even discuss, to my knowledge, in the Senate this week, the HEROES Act called for more than $100 billion more in relief to hospitals. How important is that? I know how important it is in Illinois. I can tell you flat out, as a downstater, when you take a look at the rural and small town hospitals in my state, they are struggling. One hospital administrator told me that she had scheduled 4 elective surgeries last Monday, a week ago, and only 1 patient showed up. The other 3 called in and said they were too frightened to go to the hospital and to run the risk of being exposed to the COVID virus. I cannot imagine that that is not the same situation going on in Kentucky. Isn't there a sense of urgency in Kentucky, as in Illinois, for us to move quickly to help these hospitals before they furlough more people and ultimately face closure? A disaster in any community that we want to avoid, urgently avoid. State and local governments are struggling now to pay teachers, first responders, and healthcare workers as they face record revenue losses and increased costs of fighting the virus. The measure that passed the House of Representatives last week had almost $1 trillion to help these state and local governments, not just in Illinois, but in every state, including the Commonwealth of Kentucky. In states around the country, red and blue, the Center for Budget and Policy Priorities estimates the states are losing $650 billion in revenues by next summer. By the end of the year, Kentucky is expected to lose between 10 and 17% of its annual revenues. Without help from the federal government, Kentucky's governor announced that Kentucky's recession will be longer or its unemployment will be greater. Congress appropriated $150 billion in funding for state and local governments in the original CARES Act, but that funding is not enough to make up for the enormous losses that are being faced by state and local governments across the United States. These governors, these mayors, these leaders have a sense of urgency in making up this revenue. They face the reality of cutbacks in police, firefighters, first responders, paramedics, nurses, doctors, teachers. The HEROES Act that passed the House of Representatives last week, that has not been considered this week in the Senate, included $875 billion in fiscal relief for state and localities to help cover the shortfall and make sure communities can continue to pay frontline essential workers. What about the unemployment situation? Understand the deadlines that were built into the CARES Act. The first deadline, June 30th. That's the date by which small businesses that borrowed money under the payroll protection part of that act need to have spent the money in order to have the loan forgiven, June 30th. Who among us believes that small businesses will be in a position to recover and back to business as usual by June 30th? I pray that's the case, but I know better. In my home state, and I'll bet you in the state of Kentucky as well. How about unemployment? We came through in the CARES Act and did something dramatic, unprecedented. We said that we were going to give an extra payment, a federal payment, to those who were unemployed so that they could weather this storm as their families try to adjust to no breadwinner in the house. $600 a week on top of whatever the state benefit of unemployment might be. For some families, it was just enough to get by. Understand, though, that that benefit, that unemployment benefit of $600 from the federal government each week is going to end at the end of July. That's not that far away, you know. We're talking about 10 weeks at the most. Do we honestly believe the unemployment crisis with 36 million unemployed Americans will be behind us by the end of July? I wish that were the case, but we know better. In my state of Illinois, I know better. We are hoping to start reopening the economy in a safe and responsible and careful way, and to give these small businesses a fighting chance to open their doors again and survive. But it's going to be a struggle, and many of them won't make it. Earlier this month, 69,000 people filed new unemployment claims in Kentucky, a 4,000% increase from last year. Do those families who are now unemployed feel that this response, this federal assistance in unemployment benefits, is urgent? Well, you bet it is. How many of them in Illinois or Kentucky believe that they won't need this help after the end of July in this year? July, the same month the $600 per week unemployment benefits expire, the unemployment rate in Kentucky has been projected to be 16.3%, the 10th highest in the nation. And yet the Republican leader says there's no sense of urgency of moving on this measure that was considered by the House of Representatives and passed last week. The IRS has sent out almost 2 million economic impact payments to that state of Kentucky, worth more than $3 billion, helping families put food on the table and keep paying their rent and their mortgage. When you take a look at that economic impact payment, understand that the measure that passed the House, which we did not bring to the floor this week in the United States Senate, calls for $1,200 more for each adult and $1,200 for each child. Do families need it in Illinois? You bet they do. Even though it was originally proposed by President Trump, politics had nothing to do with the support that it received from both political parties and the support this measure that just passed the House should receive from both parties here in the Senate as well. There is a sense of urgency when it comes to these cash payments to people who are struggling to make ends meet. The bill that passed the House includes a second round of these critical payments and make sure that we extend the unemployment benefits beyond the end of July. According to the Kentucky Center for Economic Policy, tens of thousands of Kentuckians have lost their health insurance as a result of this pandemic. What a moment in life to lose your health insurance. In the midst of a pandemic, with people facing hospitalizations, treatment in and out of the hospital, and in some cases ICUs, to think that you'd be without health insurance? The measure that passed the House of Representatives last week, which was not brought to the floor by the Republicans this week in the Senate, includes a provision to ensure that people who lost their health insurance as a result of becoming unemployed can remain on their employer health care plan without paying any premiums. In other words, we want to make sure that people have health insurance rather than lose it. Was that brought up this week for debate and consideration in the Senate? No. No, it wasn't. Is it a matter of urgency if you're facing the loss of health insurance in the middle of this coronavirus epidemic? Of course it is. The Paycheck Protection Program still has funding left in it to provide some loans, but businesses have to spend the money within 8 weeks of receiving the loan or it won't be forgiven. Many small business owners across the United States are facing a June 8th deadline, struggling to spend the money due to the fact that they still haven't been able to open their doors. The HEROES Act, which passed the House of Representatives and was not brought up for consideration in the Senate this week, which it could have been, would extend the deadline an additional 16 weeks, providing small businesses 24 weeks to spend the money that they were loaned by the SBA. And it would authorize the Paycheck Protection Program through the end of the year to ensure that we can continue to help small businesses through this difficult time. Is there a sense of urgency in small businesses in my state to extend this period that you can spend the money as a small business and have your loan forgiven? Of course there's a sense of urgency in Illinois, in North Carolina, in Georgia, in Kentucky, across the United States. Why the Senate Republican leader does not feel a sense of urgency on this measure, which ultimately ends on June 30th, is beyond me. I've heard from farmers across my state struggling to survive, asking for help. I've heard from the Census Bureau the need to push back its response deadline to October 31st. Measures also included in the HEROES Act that passed the House of Representatives. 3 weeks have ended here on the floor of the United States Senate, and but for a few speeches on this floor, if you read the record of legislative activity, you'd wonder if the leaders in the United States Senate even realize we're facing a pandemic. We spend our time on nomination after nomination. We spend our time in hearings on friends and those who pass political muster who want lifetime appointments to the federal court. But somehow we've managed to miss the biggest story in America, the pandemic. I'd say to Senator McConnell and the Republican leadership, we have wasted an opportunity, a 3-week opportunity to move forward. And we have particularly wasted this week when we could have taken up the measure that passed the House of Representatives last week. Are we prepared to negotiate a compromise? Of course we are. We've done that every time we brought up a measure related to the pandemic. It should be bipartisan in the end. But to say it's, quote, dead on arrival and there's no sense of urgency among the Republicans in the Senate to take up this measure, is to ignore the obvious. Whether it's $1,200 payments to American citizens who are struggling to get by, whether it's increased period of time for qualification to receive unemployment insurance, whether it's loans to small businesses so they can survive, these are the urgent needs of America. When we have hospitals furloughing employees in Illinois, in Kentucky, and around the nation, we run the risk of losing these great hospitals that are needed for the future. Is it urgent that we take up this matter? Of course it is. And yet this week we've done nothing. Zero when it comes to this measure. We're going to leave now for the Memorial Day week, which means it'll be about 2 weeks before we return. I can just about guarantee that the sense of urgency across America will be palpable at that time. The question is whether there will be a sense of urgency felt by the Republican leader from the state of Kentucky. Yesterday, on the similar issue, my friend and colleague from Texas, Senator Cornyn, came to the floor, as he has before, to discuss the issue of liability and immunity as part of the conversation of the next measure of relief and rescue for our economy. For weeks, Senator McConnell and Senator Cornyn have said that unless Congress gives broad legal immunity to corporations, they will block emergency aid to help states and local governments avoid massive layoffs of policemen, firefighters, and teachers. The logic behind this position is hard to fathom. There has been no flood of COVID-19 lawsuits. There's a website that tracks all the lawsuits filed in America, and they look for cases based on COVID-19. Senator McConnell has cited this tracking. That tracker updated its numbers as of yesterday. It reported that out of 1.5 million confirmed COVID-19 cases and 90,000 deaths, there have been two COVID-19 medical malpractice cases filed in the United States in over 1,000 complaints that have been filed, and 26 cases alleging workplace exposure to COVID-19. Senator from Kentucky has called this a tidal wave of lawsuits, a windfall for trial lawyers. 2 cases of medical malpractice, 26 cases for workplace exposure. In the other cases that mention COVID-19, they relate to prisoners in prisons and jails who are questioning whether their rights are being violated because of the circumstances, the health circumstances in the prisons. There are lawsuits against insurance companies as to whether or not the policy covers a business that has suffered losses because of COVID virus. There have been lawsuits as well between businesses as to responsibility for it. But this notion of a tidal wave of lawsuits being filed, 2 medical malpractice cases across the United States of America, 26 workplace exposure cases. And keep in mind that if you do get sick and you want to file a lawsuit, a good lawyer will advise you, be careful. Proving where you were infected is not an easy thing. And you also look to the standard of conduct of the business or individual who could be the defendant. Did they act reasonably? We had a hearing in the Senate Judiciary Committee last week on liability during the COVID-19 pandemic. I've quoted this before, but it's worth repeating. One of the witnesses called by the Republicans was a very good man and very thoughtful. His name's Kevin Smart. He's the Chief Executive Officer and President of Quick Check Foods in Bonham, Texas. He went through the litany of things that he had done in his workplace to make it safer, not just for his employees, but also for the customers that came in. It was impressive. If the statements he made to us were accurate, and I believe they were, he is doing his part to try to make his workplace safer. But here's what he said. This was a challenge because the guidance provided by the CDC, the Occupational Safety and Health Administration, as well as state and local governments, often conflicted with one another in addition to being vague and difficult to follow. Yet, despite many uncertainties, including the constantly fluctuating public health guidelines, we began to adjust to the pandemic. The point I'm making is this, and I see our Democratic leader on the floor, I'm going to wrap it up quickly. The point I'm making is this. We should establish reasonable standards through the Center for Disease Control and OSHA so that conscientious businesses can, in good faith, know what needs to be done to protect their employees and their customers. And when they follow those guidelines, I believe they've absolved themselves of liability. They have certainly a valid defense to any claims of wrongdoing. But this notion that comes before us on the floor from the Republican side goes to an extreme. Asking for government immunity from the conduct of businesses in the midst of this pandemic without holding them to any standards. We are still waiting for an explanation. Why would we allow the workplace to be more dangerous for employees? Why would we allow the business place to be more dangerous for customers? If the owner is willing to live up to reasonable standards established based on science and health, in my mind, that's a good defense. And that's the way it should be. To do otherwise is to give a green light to businesses that don't follow standards, endangering their workers and their employees. It means more people are going to get infected and sick in America, the last thing we need. Madam President, I yield the floor.